Modern life. Between careers, kids, and health, it can be mayhem. That's why we're here. I'm Dr. Lisa Varghese-Kroll.
And I'm Dr. Lonray Falusi. We're physicians, moms, and longtime friends who break it all down for you. Wondering how to juggle all the balls and still stay sane? Looking for advice but don't want to be overwhelmed?
Curious about how to make the most out of life for your family but enjoy it at the same time? You're in the right place. Welcome to Health and Home with the Hippocratic hosts.
On this episode, we're getting an inside look at that perennial internet favorite, WebMD. What's it like being a chief physician editor? How is an article crafted from the first idea all the way to publication? What are the best ways to fight disinformation? And what does that have to do with planetary health? Our guest today shares all that and more. Hey, Lise.
Hey, Lon. I am so excited for our guest today. You and I have both had many patients ask us about things that they've read on WebMD. So it's going to be fun to hear about what happens behind the scenes in order to get that information to the public.
Yeah, totally. Our guest today is the chief physician editor of health and lifestyle medicine at WebMD and the host of WebMD's Health Discovered podcast. She's part of a team responsible for ensuring the accuracy of health information on WebMD. She's also a lecturer at the Yale School of Public Health, Department of Environmental Health Sciences, where she facilitates a course in the Climate Change and Health Certificate program. She serves on the board of the American College of Lifestyle Medicine, where she's chair of the Global Sustainability Committee, and she sits on the Medical Society Consortium for Climate and Health Steering Committee. She's dual board certified in internal medicine and lifestyle medicine, and she lives in Atlanta with her husband and 3 children. Welcome, Dr. Neha Pathak.
Hi, how are you? Thanks for having me.
Thanks for joining us.
So great to have you. So, the first thing we all want to know is, tell us about your position as chief physician editor for health and lifestyle medicine with WebMD and just what that entails.
Yeah. So I think, one of the core parts of my job is to ensure the medical accuracy for all of the health information on our website. So I work with a team of physicians, other sorts of healthcare professionals like nutritionists, physical therapists, depending on what the content is. And we review every piece of content to ensure that it's medically accurate, balanced, and that any patient that's reading it or any person that's reading it, they're not a patient, they're just reading it sort of for wellness or well-being, then that content they can be assured is accurate and has been vetted by a health professional.
And that's so cool because Lisa and I obviously as you know, are both physicians. And I feel like going through college and med school and even residency, it seems like there's just a very traditional, clear path. You took a very different path, right? And you're working, in medical journalism. And so tell us a little bit about how you got there. How did you first get involved in WebMD and in this kind of work?
Yeah, no, it's definitely been a very, very fortuitous path that was not really something that I had intended for, just like what you're saying. So I think I had the same intention. I went through college, kind of going back and forth, being very ambivalent about medical school, but it was sort of something that we had always discussed as a family. You both, I'm sure, know
Absolutely.
How that is.
Oh, yes.
It's like marriage. It wasn't just a full personal, no, I love my husband.
Right.
And but there's just so many other factors that sort of go into it before you of go down this path. And I very much the same way was anticipating after residency, and I did internal medicine primary care residency. Mm-hmm. Really wanted to be a generalist and found so much passion there, having that long-term relationship with patients. And actually my first shift from what I thought happened right after residency, where I joined a position at the VA, within the VA healthcare system. Mm-hmm. And I didn't have a VA in my medical school. So it wasn't really on my radar, but I loved it. I loved the experience. I loved the team-based approach. And so that was sort of the first sort of like, keep your eyes open for opportunities. Don't just say you don't know and that's not what you're comfortable with. Just keep your eyes open. So after that, at that point, I was like, I'm a VA lifer. That's it. I'm in VA. I love it. I love this team-based approach. And then my husband and I moved to his home state of Georgia. So we moved to Atlanta. And so shifted down here to another VA. Again, really got interested in quality improvement and working with high needs, complex patients, doing care across the continuum. So home visits, telehealth, going to specialty appointments with patients with our team if they were not understanding what was going on with their specialty appointments. And again, lots of patients coming in would say, hey, well, you're saying this, but this is what I read on the internet. Or this is what I heard here. Or WebMD says, X, Y, and Z. And it really sort of confused me in the beginning because I was like, well, I'm telling you, this. Right. So why are you confused? But so I had an opportunity to actually connect with WebMD. And so I started working there just on the side, just kind of looking at content and reviewing it. And I realized, what's happening is that the content all makes sense. It's like what you're thinking in your mind as the health professional. It could be this, it could be this, but it's most likely this. But the patient is concerned about something. And the patient is usually concerned about the thing that's the most dangerous, right?
Of course.
Right.
So they're coming to you with the sort of confirmation bias that like, okay, it says it could be this, but it says it could also be, And
absolutely.
And then that's our job in the office to be that trusted voice to say, I see why you feel that. These are the reasons that it doesn't fit with your picture. And so I think that's really what drew me to this opportunity to stay with WebMD and come on full time and sort of participate in all different kinds of products. So we mentioned the podcast and the article content and then news. I was so excited to learn from the news team, the journalists and the editors. And then I started sort of asking them, can I write my own story? And they were not happy because they were like, who does this doctor think that she's going to write, And so they really helped me. That's
fantastic.
And that's sort of how I've come and sort of transitioned to where I am right now.
That's so interesting to me because my undergraduate degree is actually in broadcast journalism. So what advice do you have for doctors, researchers, others in healthcare who are interested in a career in medical writing or medical communications?
Yeah, I think that one is time. So think about whether or not it's the right time for you. I think that was a big struggle when I was trying to do so many different things was, can I do it and where is my time best spent? So I think that's the first place you want to start with what is bringing you joy. And, it seems so trite, but it really is sort of like if you like to sit down and write those articles and you feel so excited afterward, I don't think anyone, and you can correct me if I'm wrong, Lisa, but I don't think anyone sits down and actually does the work of writing and is like, I love this is amazing.
I think those people exist. I don't know.
Not it.
Right.
That's the one thing that got me through because even some of these journalists are like, yeah, no, that part is hard. It's after when you're like, I did this, I created this. It's really exciting. So if that piece brings you so much joy, then I think investing in what part of it, because now there's so many opportunities. There's podcasting, there's writing, there's potentially being interviewed for your local news station. So it's really thinking, where do you feel the most comfortable? Where is your time best spent? And what are you trying to get out of it? So is it, for me, and this is a question I really think about a lot, is that this gets to the part of my title, which is the lifestyle medicine piece. Which is I started off primary care, internal medicine, so very generalist. I have a generalist approach to everything in life, which is why I think I kind of try to do a lot of different things. But I always want to go upstream of the current problem. And so I could prescribe this medication, which there's nothing wrong with that either. But I would also love to talk to you about what's upstream of your diagnosis of high blood pressure, what's upstream of your diagnosis of diabetes. And it turns out oftentimes that what's upstream is the same thing that's causing all of these separate problems. So that piece, I felt like I love having that discussion one-on-one, but I would love to communicate that more with more people. So that's really where I found something that was exciting to me, something new that I could try. And for me, the writing part of it just feels like I have a little bit more control to think things through and put it together. I don't have to come up with something right on the spot.
I think you're really sort of articulating what one of the big motivations for Lonray and I to be podcasting. We feel the same way, sharing information with as many people as possible.
So how did you go from broadcast journalism to becoming
medicine.
Medicine?
It's so funny because Lonray and I met our very first day of college. So I was a journalism major, but pre-med all the way through. So I always had an interest in combining the two because of almost exactly how you articulated it. You know, the idea of being able to help our patients one-on-one is so powerful and I think very inspirational for probably 90% of people who go to medical school. But the idea that you could share these philosophies and this advice and, you know, your medical knowledge with a larger spectrum and potentially stop some of these problems from, you know, what we see in the patient room 10, 20 years later, that was very exciting. And I felt like, you know, I've had so many different opportunities and many different pies to put your fingers in. And we've just really enjoyed this path as well, because it has definitely been that for us, that we've been able to reach people we never, you know, would have been able to encounter otherwise.
Yeah, 100%. And I was a very unusual biology and pre-med major. I don't know if you've heard of that combination before, but it was like super unique.
Weirdo.
Crazy talk.
Crazy talk.
That's what I was
But
too.
even, right. I mean, that's what you're like, quote unquote, supposed to be. But I think it's great that even with that, and I completely agree with you, Lisa, over time, you just see how these issues they're really like public health issues, or even on a more individual level, individual people's like stress and, you know, lifestyle choices or those sorts of things. And even with the like very traditional bio-pre-med background, I completely agree that you can still find yourself doing things like education and advocacy and media, those things that I've enjoyed doing as well.
Right.
And then, of course, having this podcast with Lisa and getting to interview people like you who are really doing this on a very macro level. So tell us a little bit more, about what that is like. So as you're trying to write a WebMD article, what's that path? How do you go from conception to publication, and who's involved? What does that look like?
Yeah. The good news for me is that is not the majority of my job. Most of it is medical editing for accuracy. So if it was, you know, my life depended on writing, I probably would not have so much joy in it. So they give me a lot of room to play. And so generally it's the same thing that most people would have to do, which is to find the editor who is responsible for that sort of type of content. So if it's about primary care, then to find the editor who works within that sort of that vertical, and then pitching the story. So, you know, I'd like to write one. One of my very early ones was on air pollution and health impacts. So
cool.
I found the editor, I pitched the story, and they said, okay, that sounds, you know, much more than just sort of here's the title, but like I'd like to talk about it from this angle. What happens to people? What are some of the health impacts? What are some of the ways that people can take action themselves to protect themselves from air pollution? So they said, okay, that sounds like you can do that. Go ahead, go forth. And it took me forever. It took me that first time about 2 months of just hand wringing and like finding sources to interview. And I did the interviews and I loved it. And that's kind of like this piece, like just talking to people and learning and, oh my God, what? And then air pollution can do this. And, you know, there's so many things that we're not talking to our patients about in the office around some of those health impacts. So it was amazing, the learning part of it. And then it was like the synthesis part of it that was very painful. So that took some time. And then turn it into the editor, who then gives you sort of their feedback and we'd like to fix this, or can you give us some more information here? And then that piece is finally published. But my day-to-day is more other writers, health writers, writing content in a variety of fields. And then I have the privilege of then reviewing and ensuring that it's medically accurate. For the podcast, again, we sort of have this editorial approach, a team that comes together and just says, this is something we really think our patients need to hear. Let's find an expert in that subject and then have a conversation.
That was actually going to be another question, was tell us a little bit about your podcast, because you do have the writing part of it. But, as we know, you have this fantastic health podcast with the goal of, sharing these topics that maybe may not come up in an appointment, particularly with your generalist, where you have 20 things you have to cover in a 10-minute appointment. So tell us a little bit about your experience with that show.
Yeah, I think, WebMD has had a podcast for quite a while, and about a year, maybe 2 years ago, time flies when you're a mom, right? We were talking about
year, decade.
No sense of time at
all. I had the privilege of being able to sort of come on as a temporary host just to enjoy the experience as we were seeing if somebody else wanted to do this. And then I just fell in love with it. And I was like, please, let me do this.
That's so great.
But the essential sort of, I think the key point is thinking about who is our audience, who are we trying to reach? And I think for us, it's really that person that is making a lot of the healthcare decisions for their family and is squeezed for time. So they are really juggling so many things. And it's great to be like, intermittent fasting, go vegan or go plant, and I believe in a lot of these things. Go, eat a plant forward diet. Great. But then how do I do that if that's not traditionally what I do? So we try to cover a range, and it's still a work in progress. My other hat is quality improvement, which I haven't gotten out of yet. So it's constantly like, how do we iterate? How do we kind of make this a continuous improvement sort of journey so that if we're figuring out what's really resonating with people, how can we do more of that?
That's such a good point in terms of like just your goal of getting that information out there. And, Lisa and I talk about this a lot. We feel really strongly that people should have access to information for their own empowerment. So like you said, how do I actually do these things that I'm being encouraged to do? But we also know that Dr. Google, those random Google searches, definitely have the potential to spotlight misinformation that can be really dangerous, right? So what are your thoughts on how websites like WebMD can help people navigate that gray area between feeling really empowered, but then also the chance for harm?
Yeah, this is something that is so tough because this is not a new concept, but the internet really democratizes where we get our information from.
Absolutely.
So we can get it from anywhere. And you can have a following of 1 million people or hundreds of millions of people, and then all of a sudden you're an expert in something, or you're someone that people want to emulate. So even if they know that you're not an expert in this particular area, and particularly when it comes to health, there's so many people that just want to be like or similar to. And so it's really, these messages can be really powerful. So I think the first thing is to really get into our patients' heads when we're talking to them, because all of us have gone on the internet to look for an answer and about our health. So to really talk to patients as part of our counseling about, just make sure these are trusted places that you can go for health information. Not because you can't get important information from your friends or other people that are like you, but if you really want to understand what has been tested, what is safe, this is where you need to go to read about it. So, and then limit your sources. So it's great to go on Instagram or other types of social media and look through. And if it's bringing you joy, that's the first sign. Okay, it's all right. I'm not getting anxious. But if you start feeling this anxiety from what you're reading, that I'm not doing this right, or I'm missing this piece, then that's your first internal sign that turn that piece off and find a site where you get a sense of calm or you get a sense of actionable information. So I think those would be my two big things that I would love people to kind of understand. One is, who is the source? Make sure that the sources that your source are using are also vetted sources. So CDC, FDA, if you're trying to find out about drug information, a lot of the hospital websites that have a lot of information. So WebMD will often source those. That's where we're sourcing those sites, and then also primary literature. So you want to look to make sure the source of your source is also something that you can trust.
I think that's great advice. I mean, really, we need to get that message out far and wide. And a little bit of a pivot, but also related, tell us about your background in climate change and planetary health, because this also has downstream effects as physicians.
Yeah, and with misinformation and
Right.
intentional misinformation sometimes. I think, again, it kind of comes back to the office setting in VA for me was where you were like, you have all of these health conditions. You are coming into the hospital all the time, and I can't solve that environmental issue that's affecting you. I can't solve the fact that you're going to a house that's filled with mold, or that you live on a street that has so much congestion that the air pollution load that you're inhaling is just so heavy. Right. And so I think that was initially what piqued my interest. And then, like, for most of us as mothers, when you finally notice, like, you're slathering all these chemicals onto your kid, and you're like, what am I?
Yeah.
What just happened? Wow, I can't believe I just did that. And then you're sort of looking at them, and then you see the piles and piles of plastic waste and the diapers and not anything. I mean, we're not doing anything wrong. I think one of my core pieces that, if I could get out to people, is that we have to be we have to have no judgment, and we have to have a lot of humility with each other when we're talking to each other.
So true.
None of us are doing this because we're like, yes, I want to buy lots of plastic. We're doing it because it's easier, it fits into our life, and we're so pressured for time that it's hard to know what the right decision is. And then to your earlier point about misinformation and misdirection, and in this field, greenwashing, you also don't know what is the right choice.
Right.
So that's where a lot of my interest came, is like, how do we, again, getting it out of just that office visit, but at a higher level with more people. I really wanted to do the research and learn more about, okay, so how is climate change and environmental pollution actually hurting us, our patients right now, day to day? What is the literature on that? And then how do we communicate that in a way that's not like, you are causing air pollution? There's so many things that are outside of our control. We're driving a minivan to carry our children around because we have to. If somebody made an electric minivan, I would be very happy to buy that.
Yeah. Right. And can you talk about that a little bit more? What are your top health concerns when it comes to climate change? What should people be thinking about and looking out for?
Yeah, so I think that when we think about what climate change means, is that we're seeing certain shifts in the way that we're experiencing weather patterns, right? So that's extreme weather events. So if you're in a coastal area, that may be more coastal flooding, that may be more hurricanes, and all of the flooding and damage that comes from that. And then after the hurricane has moved on, all of the mold that can potentially grow because of the moisture that has been left in its wake. We're also thinking about contaminated water that we can be exposed to now because floods have come through and just overwhelmed our sanitation systems. So that's one way I kind of think about, like, regionally. Another is air pollution. So if we think about higher temperatures, we have to also realize that higher temperatures not only cause their own sort of health risks, but they also create this perfect storm of taking all the little particles in our air and just zapping them and creating this toxic stew of ozone. That's sort of like when you breathe it in, it's like a sunburn on your lungs, completely damages the lining of your lungs. And then other sort of concerns when we think about climate change, I think going back to heat, is that it's a stress on our bodies, but it also, because it lasts longer, is great for vectors like mosquitoes and ticks. They can now move on to new geographies. So now we have more exposures to infectious diseases in places that we didn't traditionally have those risks. So those are some of the main things that I think about, that I write about.
So, taking all that into account, because it can certainly be to people, ourselves included, that don't have a specialty in this area, it can sometimes seem overwhelming, right? For one person, compared to 7 billion humans on the earth. So what are some of the most important lifestyle changes that you suggest, just individual people make when it comes to protecting our planet and public health?
Yeah, so I think as I think and write about this more, I think we've got to stop individually thinking about how we can help climate change outside of being a climate voter. I think that's just the biggest thing that we can do individually for climate change, the global problem. What we can think about is our local pollution or our local sort of health problems. So if you're living in an area where the urban heat island is clearly obvious. I live in Atlanta. I live in a beautiful part of Atlanta with lots and lots of tree-lined streets. I drive 5 minutes down the road, no trees, concrete. So what can I do there locally or with my city council, if a city council member is like, I want to fix our tree ordinance, that's somebody that I'm going to vote for. So that's just something very simple to not make it this global problem. And then thinking about lifestyle changes in our home. So in that sphere of influence, there's really just these amazing things that we can do that are amazing for our health and really good for the planet. So one is shifting more towards a plant-forward diet. So again, as we're all health communicators, I don't like to say vegan or plant-based. You don't have to lose the meat foods that are maybe cultural or just that bring you joy. You don't have to cut that out if you don't want to. It's just shift more. The more you can shift towards having more of these plant-based foods, the healthier you are. And we know that it's critical for our underlying health. And it has a massive benefit for our personal carbon footprint, the pollution that we're putting into the environment. And there's just so many benefits to shifting to plant-based meals. The more we can do. So if you can't do 15 out of 15 for the week, can you do 2 more than you did before? So that's one big thing. And then short errands. Again, I live in Atlanta. It's a big car city, but that 3-year-old that we were talking about, I have this COVID baby our daycare is about a mile away. So I have now tried to identify myself as someone who walks this kid to daycare.
So that's great.
That's 2 miles. I'm not putting, carbon into the air. I'm not polluting my local environment, and I'm walking. And usually I'm trying to walk with other moms in the neighborhood. So your social connection too. So these are some of the things that you just kind of can think about in your own life that are protective for health, and very, very, very crucial for us to just be thinking about as people who want to protect our planet.
I love that because it can be so overwhelming, right? How do I save the planet? But I love how you've broken it down to, on the bigger level, think about who you're voting for, people who make those decisions, those policy decisions, and then our daily lives, making it relevant. I like that sort of, and we talk about this too, like small changes are what really stick, and not sort of I am never buying meat again. I'm fully vegan.
I'm vegan, right?
It lasts for a week, right?
And it's like, even when I was talking to you about the health risks of climate change, I was like, oh my God, and then this can happen, and then, oh my God, and then our patients are experiencing this. And it is just very overwhelming. So I think talking about it in the right spaces with people when they're interested
Yeah.
That's important. If somebody's kind of giving you the sign that it's making them uncomfortable, then you can shift to something like the local, like here are some local benefits to dealing with the pollution in your environment. Most people generally have less angst about managing or dealing with pollution, I've found.
That makes sense. Yeah, that makes sense. So getting back to that point of disinformation and misinformation, we'd love to hear your thoughts on what really is an epidemic of disinformation and how that's made things like taking action on climate change difficult or cooperating with public health measures like masking for COVID more difficult. So what are your thoughts on kind of where we've been, where we're going, and what we can do to address that? Simple question.
Very, very simple. I'm glad. Yes, let me
solve it for us.
Let me solve that for you. I'd love your thoughts on this too. I think for me, it comes to the fact that do we trust our sources? And there's just so many more. I think we have to really understand that our environment, when I talk to my children too, it's not just that they're getting their information from me and my husband as their parents and their teachers and maybe a handful of school friends. Now it's all of that plus their friends have access to TikTok and their friends have access to all these other sort of people and voices. So it's just a cacophony. It's too much. So I think for those of us who are interested in combating it, we have to be very, 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 very understanding about why it's happening. And I think we just cannot come at it with this judgmental approach. Like I always think about going upstream of conflict, like for something simple like vaccination in your office. There have been so many people that and I think we as health professionals are really good at this because we do this in real time in our office, is you're talking and you're kind of encouraging a health behavior and you're seeing that it's just not playing. The person is giving you all the signals like, this is not doing it for me. And we can pivot in real time to try to find what's that aha for this person? Like, what is it that's upstream of this, I'm just not going to get vaccinated. Well, what about the health? What is important? What is important to you about staying healthy? What are some of the things that we can do to, what is it that's really confusing you about this vaccine? So I think if we just don't harp on the problem, but we go up to the person and just say, well, I want to keep you healthy too. Here's the best way I think we can do that. It becomes much more difficult when you're doing what we want to do, which is talk to more people.
Right.
So I think, again, coming at it with humility and just sharing this message that, listen, yes, it's not going to be 100% of people that are 100% protected against COVID if they wear this mask and take this vaccine. This is just our best opportunity as a group to protect ourselves on an individual level. Talk to your healthcare provider. Talk to we've got to put ourselves back with that patient one-on-one because that's where we can actually make these changes. And I think at a higher level, having these sort of information campaigns is to just be like, we understand there's so much confusion. We have no judgment about this. We just want to help you find the right source for you to make the right decision. Personal take.
I love that. I mean, macro and micro at the same time. I think that's very key. Thank you so much, Dr. Neha Pathak, for joining us today. We just feel like this has been such a great conversation with a lot of great pearls we can think about after it's over. And we're just really grateful for all the, strong work that you do. And thank you again on behalf of all of our listeners.
Thank you so much.
Yeah, this has been really great. Yeah. I learned a lot just listening to you and really so impressed with the work that you do.
Thank you. Thank you so much for the invitation. And I'm so excited to follow your work.
Thanks so much to Dr. Neha Pathak for joining us today and for giving us an inside look at her career at WebMD, as well as sharing her expertise on planetary health. For more information on her background and her podcast, check out our show notes at hippocratichost.com. So that's our show for today. Thank you, as always, for listening and for all your support. Please follow us on Facebook, Instagram, and other major social media platforms, and subscribe and review us in Apple Podcasts, because reviewing helps other people like you find the show. And if you'd like to support us with a monthly donation, just go to our website at hippocratichost.com and click on the Become a Friend of the Show button. We'll be forever grateful.
And keep sending those messages with topics that you'd like to see next.
Love hearing from you as always. Thanks, everyone, and talk to you soon.
Thanks for listening to Health at Home with the Hippocratic hosts. Remember that all views expressed here are our own, not our employers, and all content is for informational purposes only and should not be construed as medical advice, nor the establishment of a doctor-patient relationship. Always consult your own physician or healthcare team for any medical issues.
If you enjoyed this episode, please rate us, subscribe, and tell a friend. And check out our website at www.hippocratichosts.com for show notes on this and all our episodes. Can't wait to chat with you next time.